Hi, I'm Marcelo Kauffman. I'm a neurologist, a neurogeneticist. I'm working currently at the hospital Ramos Mejia, Buenos Aires, Argentina. And I have the pleasure to give a plenary lecture during the last International Parkinson Disease Mood Disorders meeting at Madrid. And in that occasion, I was discussing the impact of genetic testing in hyperkinetic movement disorder. I discussed especially the impact on treatment that knowing the precise diagnosis of this type of condition that present with hyperkinetic movement disorder can offer. For instance, I discuss the examples of dystonia, genetic dystonia, where it's well known the large effect of DBS on their management, such as the well-known example of DYT1. There is now almost 20 years of experience of the use of DBS in this type of patients, where the use of DBS obtain a very, very good response in the movement disorder. After DYT1, there has been very well reported the impact of DBS in other genetic dystonias, such as KMT2B. You can classify the different impact of genetic testing in the management of movement disorder or hyperkinetic movement disorders in particular, perhaps a little in a little artificial way, but it's good for educational reasons. So I've discussed that the use of genetic testing is good for choosing a therapeutic approach, such as in DBS genetic dystonia. I also discussed that the use of genetic testing is good for choosing a therapeutic approach from a better knowledge of other mechanisms. For instance, in Doppler responses dystonia. So this is a very good example of where you start knowing which gene is affected, and after that, which pathway or which enzymatic synthesis pathway is affected, and you can act in consequence after that. And this is the very well known of Doppler responsive dystonia. Another good example of the impact of genetic testing was presented when I discussed drug repurposing. And this is another after consequence of a better knowledge of pathomechanisms and pharmacology. And there I presented the example of paroxysmal dyskinesias and episodic ataxias. And in paroxysmal dyskinesias, in kinesogenic paroxysmal dyskinesis, especially when it's caused by mutations in PRTT2, is a very good example of drug repurposing, where the use of sodium channel blockers like carbamazepine is of an exceptional utility in these patients. And finally, I discussed that the use of genetic testing is leading a therapeutic approach when there is an inborn error on metabolisms. And in this case, you have to, for instance, replace what is missing, what enzyme is missing. And this was a very good example of some inborn error on metabolism causing movement disorder like ceroid neuronal lipofuscinose.
Finally,
during the last part of the presentation, I discussed what I presume would be the future of genetic testing in the management of the future of the impact of genetic testing in the management of movement disorder, and in particular hyperkinetic movement disorder. This last part of the presentation can be divided in two parts. The first was devoted to discuss some therapeutical development. In particular, the use of a model of precision medicine, a model of individualized precision medicine, where you can model better the disorder affecting a particular patient, taking as an example, as previous model, what is now being used in the therapeutical development in cancer, where you can use iPSC in order to have neurons for these patients, and after that you can grow this iPSC in what is called cerebral organoids, and in these organoids you can try and prove and select and make drug repurposing as well in order to choose a therapeutics that is tailored to this individual patient, and it's tailored to the particular mutation affecting this patient. So I envision a future of N of 1 precision medicine, or N of 1 therapeutics development and treatment, and all of this is a consequence of better knowing the pathomechanisms acting in the disorder affecting our patients. And the last part of the presentation discussed the challenges and the limitations of really understanding the genetic basis of complex biology or complex pathophysiology. I propose there that a revolution is warranted here for the future practice of precision medicine, and this revolution might be in some way mirroring what happens in the history of physics, where a classical deterministic physics, like Newtonian physics, was complemented and replacing in some explanation of some physical phenomena by quantum physics, where determinacy is converted or is replaced by indeterminacy. So I envision a future where we can use these principles, in particular the principle of indeterminacy, in order to practice better medicine, in order to practice a real divergent precision medicine for our patients. Thank you.